I am so excited to be here with my co-host Sara Naab and also Marc Sklar. And welcome and thank you so much for offering your time for this amazing conversation during this week. So welcome everybody. Hi.
Hello.
Thanks so much for having me.
And it's such a pleasure to have Marc with us, and I want to tell everybody before we start our conversation about you. And just like me, we've been around the fertility area for a while. You've been doing your wonderful offering for 15 years, and you've been helping couples who are struggling to conceive have healthy babies, which is such, that's what we're all about this week, making dads and creating healthy families. So in addition to his Master's of Science, Marc trained at Harvard Medical School Mind Body Medicine Institute. Woo! He created the Marc Sklar and reproductivewellness.com. He's the co-author of Secrets to Conceptions. Boy, I needed that a long time ago. And he has extensive experience and expertise in training and resolving the cause of infertility and reoccurring pregnancy loss with classical acupuncture and Chinese medicine. A cumulation of studying world religion, that's a whole awesome topic all there by itself, and ancient healing techniques combined with extensive world travel. Marc has a unique understanding of the body, mind, and spirit. Oh, man after my own heart. A doctor of acupuncture, board-certified herbalist and Oriental medicine practitioner, and fellow of American Board of Oriental Reproductive Medicine. That's so neat. I didn't even know that was a place that you would go look for references and stuff. I love this, too, that you approach your patients with open-minded compassion and medically integrated perspective, because that's where I live, a holistic approach to this, because you can't compartmentalize this. It's all of you, every part. So God bless you for what you do, and thank you so much for being here.
Thanks so much. This is I'm really excited to be here, and I really love the topic because it's something that I'm sure, as you know, because you created this wonderful event, it's a topic that's all too often ignored and not discussed enough. So I'm really excited to participate and share and be involved in the process.
Well, what I love about the time now is that this is so I want to say I want to use mainstream, because way back when I was trying to create my family, I was seeking out the herbal complements and the Oriental, the Chinese medicine, and it was almost like the back streets. Do you know where to get this, or you know where to go? And so I'm so thrilled for the advancements that we have as a group about what you do, because it was so needed way back when in my day. So thank you so much.
Yeah, my pleasure. No, I agree. The fertility world has come a long way since I've been involved in it in the last 15 years or so, and it's really, I'm excited to see kind of the progression and where it goes. But you're right, the way we've been able to kind of accept and build in and bring all these different treatments, if you will, and modalities and medical services together to start to really better treat our patients and those who need our services, I think has really made such a big difference and big impact. And it's unfortunate that it didn't happen sooner, but at least we have it now, and we can take that and take it to the next step.
Right. Well, thank you. So, Sara, what did you have on your mind? I can see all those questions buzzing around.
Yeah, there's so many. I mean, I'm listening to you guys talk and thinking about the wellness and the wholeness approach, and thinking about the whole man. And in the fertility journey, we're not often thinking about the whole man, and this is a really chance. It's Men's Health Month. And so, there's a lot of people out there talking about men's health, and I think men's health has a big impact on a man's fertility. So maybe we can start there with just, for you, Marc, what Where do you start with a whole man?
You know, you mentioned something that this is Men's Health Month, and you know, men's health has such a big impact on male fertility. So it was something that I've been talking about with my patients for quite some time, and so I feel like this would be a great place to just mention it. That, you know, for me, male fertility issues are really a microcosm of a greater issue going on in the body, right? And so, you know, this perception that we are individual components in our body, and that one part of our body does not communicate or talk to the other, I really think has really needs to be thrown out the window at this point. I think we can all agree that we were created as a whole being, that our cells communicate and talk to one another regardless of what area of the body that they're in, and this is no different. And so when our body as a man starts to break down a bit, you know, one of the first things that I find that's going to happen is that our reproductive function is going to decrease. And this is a really natural, very normal response in the human body as we prioritize our function and what's important. And reproduction is not as important as staying alive. So in terms of prioritizing our body's ability to stay alive and do what it needs to do first and foremost, reproductive issues are going to go by the wayside first. And so when we start to see that a man is having reproductive issues, I think it's important to take a step back and say, well, what else is going on that's causing this or potentially causing this, and why? And ask these questions of why. And often that doesn't get addressed. It's really, okay, we've got low sperm count. Okay, how can we fix that, right? And it's about patching that little break up, if you will, and putting that patch on. And for me, when I approach my patients, and I go into this sort of detail a lot when I start to work with patients one-on-one, is about asking that question why and investigating more. So, you know, when you ask when you ask that question, Sara, as to what sort of things come up for men and what do we do about it, really I think it's important to first ask that question as to why they're standing in this office and what we can do about it, and then it's about finding out what the main issues are. And I usually break those down into 3 groups. The first one is about the sperm, right? Sperm count, how much sperm there are, and does that fit or meet our needs? Motility, do they swim well, fast in a forward direction? And then morphology, the way they look, the structure of the sperm, one head, one body, one tail, or you know, what variation of that do they have? So that's one aspect of it. That's number one. The second aspect that I look at is structural issues. Is there anything going on structurally, whether it's in the penis or the testicles? It's usually in the testicles that we have issues, such as a varicocele, that it can be causing a disturbance. And then number 3 is hormonal issues, for instance, like low testosterone. And is that causing a repercussion in, let's say, sperm count?
So I have a question for you. So when when do you find that men of your patients or clients, what state gets them to come into your office? Because I love how you explain that, because I talk about that within my clients too. You're mind, body, and soul. There's a whole bunch of communication going on that we're not even aware of. And so I'm wondering, the way I think about it when I talk to a client is on a, you know, the scale of being open or are they shut to this information. So what, you know, when you see a male in your office, you know, when they come in for an appointment, you know, what is their motive, or how do they get to you? Maybe that's the question.
Yeah, unfortunately, men are, we ignore things. Let's put it that way. So we have to be beaten on the head with loud pain or discomfort for us to really take effort to make change in our health and seek help, right? The other interesting thing about it is, with women, you go see you're born, you have a pediatrician up, let's just say up until you go to college at 18. And then with women, they go right into an OBGYN. So it's very common for them to get continuity of care annually, right? Men, they leave their pediatrician and then they disappear. They're off into the ether unless they have some sort of health issue that drives them to find a GP, which is very often there's years and sometimes many, 10, 15 years in between, in that gap. So they're not conditioned to believe that they need to be proactive about their care. They have to be beaten on the head with a lot of discomfort to try to take action. And so I think we have to start to create a new mentality, a new focus for men to start to get them to understand that we need to take care of ourselves. So usually, I chuckled when you asked the question because usually they're being pushed in by their wives to say, look, we've had issues long enough. Now I want you to get tested. I want you to do something about it. And unfortunately, I think I don't want to say it's too late, but they've waited too long to do that because they could have been proactive much sooner in the process. And when you have the statistics about 35 to 45% of all reproductive issues are male-related, right?
Right.
That's not a small number. So, I think it's really important that men understand that there's a lot for them, that they contribute a lot to this process, and many times, if not often, that they are a big factor and a big cause to the difficulties that someone might be achieving. So, I want them to understand that that's the case. And so, unfortunately, no, they get pushed in by their wives to come in. And I use, I've been seeing a patient for probably about a year now, and she's been coming in, and when the first day she came in, to her husband's credit, he was with her because that's not always the case. But 2 weeks ago, he came into my office for his own consultation.
After a year.
After a year, right? And they've been struggling for quite some time, and she's been pushing him to come in, and he, all sorts of excuses, and all valid excuses. I'm not trying to use them as excuses, but all valid reasons. I'm too busy, I'm working, this, that, and the other, right? And when he came in, we had a real conversation about his role in the process, and you could see his eyes light up, like, wow, you mean one of the reasons why we're having issues is because I haven't made time to come in, right?
Right.
So you could see it in his eyes. His eyes were lighting up, and his brain was signaling. He was like, wow, he was starting to take ownership of it. And his wife has been asking him to do all sorts of things for so long, and he wasn't doing it. So last week I saw her. I put him on his plan. I told him what I needed him to do. I saw her last week. I said, how's he doing? He's like, he's doing great. Yeah, there's some little bumps in the road here and there, and we're still trying to manage that, but he's taking all his supplements that I recommend, and he's following through with the diet. And the switch was that he took ownership, and he took responsibility, and he realized that he played a much bigger role in the process than he ever thought.
So if I process what you say as a mom of a teenage boy, and the learning opportunities or the teachable moments about men's health really should be continuous. He's 16, turning 17. Pretty soon we're going to be that gap that I actually just had a conversation. He'll probably kill me, but he knows what we're doing this week, and I said to him, you know what? It's so important for self-examination. You talk. He knew I went for a mammogram, and that's what spurred the conversation about what you need to have self-examination. And he's like, don't even talk to me about that. But that speaks to just what we talked about before, Sara and I, with another person, is like the mask that men are taught to put on about and I don't want to use the word disconnect, but there's a disconnect between what they have to present out in the world and then that relationship with themselves. Because in that moment when I said to him, we need to talk about how you do self-exams, especially, the rate of incidence, from 15 to 30, 34 about, cancer, testosterone cancer. And so I just love what you're saying, because it's a whole systemic way of bringing up boys to be self-nurturing and not have that stigma to it.
Yeah, no, absolutely, and I think it's going to take some time for us to make that shift and that change, but I do think that that's a very important change and shift to make as a culture, for men to take more responsibility over their health, their needs, and their potential issues. I think that's really, really essential. When I started seeing, I haven't always lived in San Diego. When I moved to San Diego, I found a GP, and I made an appointment, went in to see him, and he looked at me, he did his physical, he did blood work, and he looked and he said, "You're in great health. Why are you here?" Right? And he said, "I don't need to see you for like 5 years." I was like, "I'll probably be back next year."
Right. Right.
And so I'd rather go in and they say, "Oh, everything looks great, everything's fine," and even though I approach and take care of myself from a very natural, holistic, and perspective, you still have to look at things from both sides of the coin, right? And there's Western medicine, even though I live in this natural world of medical interventions, we still have to use Western medicine for its benefit and for what it offers, and so it's about putting those two things together. In balance.
Yeah. And
yeah.
That's Sara and I have been having, this is our second wonderful year of these conversations, and it's really about bringing awareness and focus, but also talking about the balance of it, the balance of your mind, body, and soul, and giving men permission to do that, and not have it feel like, oh, that's a feminine thing, because
right.
it's divine masculine energy. We all have that, and we all have divine feminine, and it's balancing that. So that's great.
So I have a question, Mark.
Sure.
Talking to a lot of men about their health, and generally about going in to see a doctor, I think men have a different relationship with the medical community, and I think there's a lot more apprehension and a lot more skepticism about, like you went in, yep, you're fine. Okay, so why did I take time off work and blah, 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 blah. You didn't give me anything, right? I think this is particularly true in approaching your specialty, right? I think men are a little bit nervous about acupuncture because, oh man, are you going to put a needle in my dick or what? Like what's going to happen here? I'm a little bit, I don't know, this is kind of voodoo stuff. What's happening? So I think it's a really good opportunity for us to just dispel some of those myths and let's get that, what is it actually like to go and visit an acupuncturist?
Sure. Well, we're definitely not going to do that. Although there are theoretically points around that area that we could use. I just very rarely use it. I can't say that I don't always use points around that area because I have. But it's very, very infrequent. So in the last 15 years, I've probably used it on, 3 patients total, 3 or 4 patients. And the reason is because there's many different other points that we can use that have very similar effects to what we're trying to achieve. And so, when patients come into my office, I can't speak about everybody else's office, right? I'm only going to speak about what the experience is like here. But when patients come into our office, we do a lot with them. I know the word we use, and the word you mentioned is acupuncture. And acupuncture is one modality we use, and a very important one at that. But we do a lot of other things. And the encompassing world of Chinese medicine as a whole offers more than just acupuncture. So in the United States, acupuncture is the catch-all term for Chinese medicine. And so in my practice, what we would probably use is, after our initial evaluation and diagnosis and assessment, what we'll end up doing with patients is putting together a whole plan. And during that plan, they'll get, these are the herbal supplements that they'll need, this is the vitamins and nutraceuticals that they'll need, this is the lifestyle changes I want them to do at home, this is the type of exercise, how much sleep, any self-care or home therapies that we need them to do at home. We're going to put together all of those things, so it's not just one thing. And then on top of that also is the acupuncture. And so The acupuncture is just one component of what we offer patients, and a lot of the work I do now with patients is online, and that online work actually has no acupuncture involved. It's really everything else that we guide them with. But specifically to your question in regards to the acupuncture, no, we're really trying to regulate the whole body. And so when we're regulating the whole body, we don't need to put points specifically in the area of concern, or use points specifically in the area of concern, because there's many points that drive and dictate energy and blood circulation to those areas. So much, let's just say we're trying to clear up a varicocele, for instance. We're trying to increase and move blood through the testicles. So we're not putting points into the testicle, needles into the testicles. We're going to put points in different locations that, over the thousands of years of research, have been shown to increase blood circulation through that area. If we're trying to increase blood count, sperm count, and cellular function, we're going to use points that we believe, based on their diagnosis, are going to achieve that end goal. So much of the points that we use are in the ear, the low abdomen, the low back, the arms and legs, but all of it's based on our initial diagnosis and what we're trying to achieve overall.
That's important for, if you were a newbie, if you're a newbie to this different approach to wellness, it's important to know, what to expect when you.
Yeah, I would just kind of plug it that when I was doing my fertility thing, I did some acupuncture, and man, most relaxing time of my week. You go in, you get the needle, and you just pass out. It's like your stress goes away. The rooms are usually pretty nice, and you're just like passed out. So I would just say to men, this is a chance to get a great nap and have your wife think you're doing something. So you get lots of points.
Yeah, and to that point, I'd actually say most of my men really, they fall asleep very quickly. They relax quickly. I always joke, what man doesn't need a little rest or nap in the middle of the day?
Right.
For 30 or 40 minutes. So
right.
You put me on a table right now, I'll be out in a couple of minutes, and I wake up and I'm all refreshed. So it's great. It's great for patients. It's great for men. Most of them are skeptical in the beginning, and then once they do it, they love it.
So another thing I really heard you say was, like, there's a lot of lifestyle, there's a lot of supplements, there's a lot of. It seems to me that what you really are for men is a kind of a coach, in that you're giving him kind of a game plan, a very actionable list of things that he can do to take control of his own health and reproduction and his part of this. And so maybe we could talk a little bit about your role as a coach and what kinds of things you recommend for men to do to take control, because here we have men that are just they're listening and they could do some of these things.
Yeah, absolutely. In any health issue, I believe kind of the three primary things that we as individuals, men or female, need to focus on are going to be the basics. Okay, and if patients can really focus on the basics, the things that they can control, the things that they can do and moderate, because those are things that they do every day, all day, right? That they're going to have the biggest influence and impact on their health and their life. And male fertility is no different. The most, some of the most important things that I talk about with men are going to be nutrition and lifestyle changes, and habitual changes that they do or go through. And so, these are things that we all intuitively know. And so let's just talk about kind of three things that I think are essential to live and survive and to kind of thrive to some degree. We need to do three essential things, and these are things that we do all the time. We eat, we sleep, and we breathe, right? Let's just kind of keep it in those simple terms. So two of those things we can control, but for all intents and purposes, at some point, we're going to do them whether we want to or not, right? Consciously or subconsciously. So that's sleeping and breathing. Is it better to get better quality air and more air into our lungs so it can oxygenate the blood? Absolutely. And that's where exercise comes in, and doing proper exercise or meditation with good deep breathing Those are some things that are going to be important. And not, we all don't need to do, crazy workouts. We don't have to be in the gym for 4 hours every day, really killing ourselves or pushing ourselves, but we need to move, we need to take deep breaths, we need to do cardio, and it could just be somewhere around 45 minutes to an hour daily. The next thing is sleep, and I think this is really, really crucial and something that is often overlooked. We're in a society right now, in a culture where we're trying to push ourselves, achieve more, strive for more. We've got so many more things that we're trying to control and manage in our daily routine, and even though our phones are meant to make things easier, they really just make us more consumed, because now we've got more to do and more to follow, and I love what it does for us, but now it's harder to put that down. And so it's really, really essential to sleep well and to sleep enough. And so it's about getting a minimum of 7 hours of sleep, hopefully 8, continually without any disruption, so that our body can rest and rejuvenate. At some point, you can stay awake, but at some point you're going to pass out if you don't control it. But it's better if we do control it. And then the third thing is really nutrition. There's nothing more important than what you put into your body and what you feed your cells. And so these are things that we have to do this 3 times a day at minimum, if not more. Some of us might do it less, although that's not beneficial for us. And so it's about, keeping it simple and eating the way we were intended to eat. Whole foods, unprocessed foods, not tons of sugar, not a lot of alcohol, not a lot of caffeine. I tend to be a man of moderation, so does it mean that we have to be, a monk and seclude ourselves from things and not have to have some alcohol on occasion or not enjoy ourselves? Absolutely not. But there's got to be better balance than what most men, I find, do, right? Because when we like something, we really like it, and we're gonna I live in San Diego, which is one of the beer capitals of the country, and as much as I like beer, I try to moderate, and I really haven't had any beer in probably about 5 or 6 years at this point. But most men I find here, because they like it and it's so readily available, they just have it all the time, and then they wonder where their gut came from, right? They call it a beer gut for a reason. So, it's about moderating ourselves, eating the right way. It's, when I tell patients the way I want them to eat, they're like, oh, okay, that makes sense. I'm not necessarily telling them anything earth-shattering. It's about eating whole foods, eating regularly, feeding your cells, feeding your body, listening to your body. If you eat something that upsets you, let's try not to do that again, right? If you go out and binge drink, and then the next day you wake up, and the next 2 or 3 days you've got no energy and you're out of it, that probably wasn't the best thing to do, at least not on a regular basis. So it's about finding balance and moderation, and these are the things that I work with patients one-on-one, because everybody needs their custom plan, I believe. It's not a one-size-fits-all. Some people sleep perfectly fine and others don't, right? So we need to create the plan that works for each individual. And we all have our own issues and little nuances that need to be accounted for, our crazy schedules or whatever it might be. And so it's about customizing those 3 components and then some for each individual based on their needs and their diagnosis.
That's
I love that. I was just listening, and I think sleep is something that gets really overlooked, and in a lot of the research that I've done, there's a pretty decent connection between testosterone and getting enough sleep. And I think that men don't realize this, but we have this low T epidemic, right? And all these guys, this low T, and I've low, it's on the commercials. I feel tired. I got low libido. What's going on? And I think that there's a lot we can do to educate about testosterone will make you feel better, and you can make more testosterone if you sleep and really reset your clock. If you stop drinking alcohol and converting that to estrogen, maybe we could talk a little bit about some of the other, how does this impact your whole life, these kinds of things.
Yeah, I'll bring up two key points, especially as you bring up low testosterone and then how much we have an effect on our health and what low testosterone means for men. when I see low testosterone in my practice, I specifically start utilizing, or let's just say someone comes in and they already know they have low testosterone, but oftentimes I diagnose it as well. I use a lot of lab work and functional medical diagnostics to figure that out and figure out the why behind it. So it's very easy, especially in the way things are marketed today. I've got low testosterone, let me go find someone who's going to give me testosterone and boost it up. But oftentimes you'll see that patients are given testosterone, and yeah, their testosterone levels rise potentially because they're given testosterone, but nothing else changes, right? And that's because they haven't fixed the issue. And so when I do my workup, I'm going to look at what's the real underlying issue. Where is it coming? What's going on? Are you not able to metabolize your hormones properly? How are they being utilized? Or you have more total testosterone or more free testosterone, and how is that being used? And so these are all things that influence one thing or another. And as you mentioned, like, is it turning into estrogen? Now am I becoming more estrogen dominant, which doesn't get talked about enough with men, right? So we have to figure that out and figure out the why. But also, our lifestyle has a huge impact. As you mentioned, sleep is essential for something like that. So is exercise and the foods we eat. So I'll use this example one day. I was in a fertility clinic because I do a lot of work with fertility clinics and my patients. And so I was talking to an embryologist at an IVF clinic, and we had a patient we had been working with together, and he came to me because he had poor sperm quality, and pretty much all his 3 factors, count, morphology, and motility, were all poor and pretty low. And so, and then all of a sudden he had started working with me, making some changes, and he went in and his numbers changed dramatically, right? And so I was talking to the embryologist, and the embryologist was saying, well, it's amazing because the last 3 readings that we've had from him, they're terrible. And so when I got this reading, I actually needed, I triple checked to make sure I wasn't testing the wrong sample. He thought he confused the samples, right? It was that dramatic of a difference. And so he didn't call me, he called the patient and said, you know, I just want to make sure this is the right sample, and can you tell me why it was such a big difference? And he said, well, look, in the past, I was traveling some ridiculous amount of time for my work. I wasn't sleeping. I was eating terribly because I was on the road. I mean, every life factor that you could think of was just in the crapper, right? It was just terrible. And then I said, look, you can't, if you're expecting to get the results you're looking for you and your wife, you can't keep doing this thing that you're doing, right? So let's change some things, and let's find out where we can change them. So we made moderate changes based on his work schedule and so forth, and try to mitigate anything that we could. And I mean, the samples were night and day, so much so that the embryologist thought it was somebody else's sample. And so this is just a clear example of something that I guided him, but he had control. He's the one who did the work. I can't do it for him, right?
Right.
So he did it, and his testosterone levels changed, his sperm count, morphology, motility, everything changed so dramatically that people didn't even believe it was his sample, right? And so this is from 2 months before to 2 months later. So these are things that we can absolutely control, which speaks to your point about getting sleep and how much we as individuals can control this sort of epidemic of low T.
Well, you know what is so amazing about that is that you think your awareness comes into you. You know, you bring your awareness back to you and what you're doing, and then you make these subtle changes. Because for me, within my clients, you know, there's a little sense of being victimized by the circumstances, but then to be empowered by just making those subtle changes. Well, okay, go to bed maybe an hour earlier, you know, right. And sleep. You know, get. You know, if you do that every day, that's 7 hours. You know, you're already sleeping one night in over a course of a week. Exactly. But I think it's you can feel overwhelmed and not know what to do, but then you have these little steps, like just. And the one thing I took a note about when you were talking about was, you know, we talked about alcohol consumption and then choosing what to eat, but what about, you know, I've noticed that there's some new studies out about water and being hydrated, and you know, I'm one of those girls who always has their water with her, you know, not in the plastic bottle, but, you know, just drinking water. And I say that to my kids. And I don't know, just to see, instead of reaching for that Coke, you know, or soda, or, you know, that another iced coffee, you know, just a substitute, maybe, you know, 2 glasses of water during the day, which is an easy peasy kind of change too, right?
Yeah, absolutely. And I don't want to make it seem like I never have a glass of wine, or I don't have my cup of coffee in the morning, because I love my cup of coffee in the morning.
Yeah.
But I limit it to 1 small cup of coffee in the morning. And I really try to make sure that I'm getting enough water and staying hydrated. And so our bodies do need quite a bit of water and hydration. Our cells need that hydration. And when we're dehydrated, that's going to have a trickle effect, because over time dehydration is going to start to, you know, I usually use the term or this image of grapes and raisins, right? Do you want your cells to look like raisins, or do you want your cells to look like grapes? Or
right.
Somewhere on that spectrum. And I want my cells to look like grapes. I want them to look nice and plump and ripe and watery and juicy, right? Not like a shriveled up raisin, although those taste a little sweet, but, you know, it doesn't have the nourishment and water that we need. And so it's about hydrating our cells to look more like a grape, so that way we can get all the proper nourishment and nutrients from those cells, so they can do what they're supposed to do.
Right. So, Mark, can we use that image for another part of the body too?
Absolutely.
Another part that we want nice and like a grape, not like that raisin, right?
Exactly. Exactly.
Grapes, not raisins.
You know, you know what we're talking about. So.
Which means we don't want them too hot, right? We got to keep them cool. Yeah.
So, you know, I would reflect also on that. I've done a decent amount of work looking at and talking to sperm banks, and you know, these are kind of the you know, it's like 1 in 100 young healthy guys, right, become sperm donors. But and when someone becomes a sperm donor, they donate like 3 times a week or so. And every time they're going to get a semen analysis done. And what's interesting is you'll see these sperm donors having really, really high counts and really great sperm, and then all of a sudden it's going to tank. And the sperm bank's concerned, the sperm donor's concerned, because everybody's, you know, relying on that sperm, right? It's important sperm. So what's happening to him? And the sperm bank will call and ask, and he'll say, well, you know, these are college guys, so it's like, yeah, I went with my buddies to spring break, and you know, so yep. I think this is kind of a very uplifting thing, or a very encouraging message to send to men that, you know, there are things that are in your life that have a dramatic, like very dramatic impact on your fertility, and you can be a healthy guy and really just, you know, put your sperm in the dumper. And if you're not kind of aware and you know, going through treatment or seeing this or following this, one bad semen analysis could make you feel like, okay, I have some, you know, issue that is devastating, when really you have an issue that is correctable, that you can take control of. And you know, that's not always the case. There's other causes of male fertility that are much more permanent and you know, need medical, like, you know, serious intervention. But there are some, you know, where it's just you just need to take better care of yourself, dude. So I would share that. Yeah,
it's true. You know, it's something like. Oh, go ahead. Sorry.
No, go ahead.
I was going to say something that I think, you know, it's definitely never discussed very frequently, although maybe amongst women, but certainly not amongst men, is how much the type of food that we eat affects our semen, right? And so I've heard women comment and say, well, semen can taste different from one person to another, or from one sample to another. And I was really shocked the first time I heard it, because it was many, many years ago. I think I was a teenager. I was like, I don't know what they're talking about, right? But it really spoke, and what they said was, if they, because I questioned them on it, and I still do to some degree with patients, and they'll say that if my husband or partner has a better, healthier diet, their semen tastes different and tastes better, it tastes sweeter.
That's interesting.
Yeah.
That carries over to a lot more happier men. That's the byproduct of eating a healthier diet, right? Because
right.
you don't have to go there. But
now we're getting to the interesting stuff.
Yes,
exactly.
So I think that was the pearl of the conversation, Mark, today.
I'm glad
this
to
we
help
need to
out
talk
with
about.
everybody's needs.
That was it.
We need to talk about on Friday about restoring your sex life. That sweeter.
You
there
should
you go.
Because John Gray and Tamara Green are talking about that, and I'm going to bring this up. And I know I'll be red because I can see it now, but you know, that was a tip of the day.
There you go.
That's a tweet right there. Well, this has been.
So I think this brings up one other question, though, about diet. And I think, you know, when I hear from guys a lot, I get a lot of emails of men asking me specifically what supplements. And I think this is because men have some connection to supplements. They use them for working out. This is like the guy's first line, I think, of defense is, okay, something's going on. I need a supplement. What's my supplement? So maybe we could talk a little bit about supplements, about antioxidants, and what do you recommend? Do they actually make a difference?
Yeah, you know, I do think that supplements make a difference, and especially with the type of nutrient deficient food that that we're exposed to or have access to in this day and age. So I do think supplements are important. I think good supplements are really important. So I really don't encourage anybody to waste their money on, you know, a $5 multivitamin from the local drugstore. You know, I think that's really not going to get them far at all, and for that, you might as well save the money and keep it in your pocket, use it for something else. But I do think vitamins are very, very important. I do tend to customize each thing for patients, so sometimes it gets a little tricky for me to, you know, recommend certain things, but I can say in general, the things that I like to recommend are a good quality fish oil, which is essential, hence the name essential fatty acids. I do think a really solid multivitamin is also important for men. And sometimes you can find them, as you mentioned about antioxidants, sometimes you can find them with the antioxidants in them, which is one of the ones that we use here in the office. But sometimes you're just adding the antioxidants separately. What I'm not really a big fan of is those blends of formulas designed for male fertility, because it tries to be this one-size-fits-all that I don't really think is necessarily possible, and I think that they end up compromising on dosage and quantity of specific nutrients, whereas I like to say, well, you need specifically these 2 or 3 nutrients, and I want to give those to you in really high dosages, so I'd rather give them to those patients separately. But I think, you know, a multivitamin, fish oils, I think everybody in this day and age should be on some amount of vitamin D, depending on their levels, and I think that's essential for fertility, both male and female. Right. And then the last thing, is you kind of had pointed out, is antioxidants. So anytime we're trying to change and influence the cellular structure of sperm, and at a DNA level, you really need to affect the cell directly, and so that's where antioxidants come in, because they're going to provide the nutrients. They're going to start to kind of rehabilitate the cells. That takes a bit of time, at least about 3 months, maybe more, but those antioxidants are really going to drive and support and improve morphology and potentially motility as well, or one aspect of what I put together for men. So I do think antioxidants are essential. There are some research studies around that, and usually what they point out is specific antioxidants versus like a blend, but you know, I think when we can use the term antioxidants as a whole and be pretty safe.
Okay, but that goes back to creating a personalized plan for individual people, because it's not one size fit all antioxidants. You know, it's really,
Right.
you really need to have a consultation to figure out, you know, what's specific for you. So,
Yeah, I mean, I said that to someone yesterday. She was asking me about some of the information that I was sharing on our website and our YouTube channel, and I said, well, that's really for, you know, just general information. It doesn't necessarily mean that everything I mentioned there is specifically something you should be doing, right? So,
right.
yeah, it speaks to that.
Well, this has been such a informative, fun conversation, and I hope we covered. I think Sara has the last question. Last year we asked everyone the same thing. You know, what was that one little tidbit? But Sara, what do we have?
I was just thinking that. What are your parting words? You know, for your everyday guy who you know, is either just starting this journey or has been in it for a little while, and is really wanting to take a bigger role in participating in this process and taking steps to become a dad. Some parting words of wisdom that you could share.
Yeah, you know, I think that well, first, if someone, hopefully, most men who are watching have already been tested and realized that you know, they have some responsibility in this process. But certainly, if you haven't been tested, I really encourage everyone to get tested sooner rather than later, because it takes time to make change. And really start to be proactive about the things that you can do to influence the fertility process for yourself, and give it the time that it needs. These things are not going to happen in a week or a month. They need some time to change the quality of the sperm that you're producing and your overall health, and so you need to give it that space and that time, and really take responsibility for your part and your piece in this process. Take ownership of it, and it's not always a comfortable time or a comfortable road, but it's something that's important for all of us to do, and really start to make those lifestyle changes that can dramatically influence your health and the direction that you're going. And you know, kind of in addition or a follow-up to this conversation, we posted on our website, we created a page with 3 separate videos that I created to give more information and more useful tips that men can start to do at home now, to take ownership and to move in the right direction. And I think you all have that link and can give it out or share it as needed. But
actually, your link is right under your bio on the summit page. And of course, and in closing, is there, if someone is listening and wants to get a hold of you directly, you know, what's the best way to do that?
You know, I think the first thing I would say is to follow that link and watch the videos. And then if they want more information and want to work with me more one-on-one, they can do that at my website, marcsklar.com. But really, I want all the men to take ownership, make the changes, have a healthy life for themselves, have a great relationship with your wife, and have and grow a healthy family.
Yay! Thank you so much. This was wonderful. Thanks, Sara. I so appreciate everybody's time, and you know, God bless. And it was great. Thanks. Now when I look at a raisin,
yeah, thank you.
Bye, everybody.
Bye. Thank you.
Thank you.